you can't really do a study like that.
But the one thing about radiation is once you're toast, the only kind of surgery that you can have after that is salvage surgery. Regular surgery is out of the question because you're mush inside. So that, that's a one-shot deal. You can do surgery and radiation, but you can't do radiation and then surgery. And that's one thing that I thought about. But, hormones, I know that's in there, but it's very difficult for a guy. It just is. And there's no answer, I know, because after all, it's my body.
Right, and you have to individualize the treatment for the patient's age and well-being and other morbidities. Does he have heart disease? Does he have diabetes? And, that sort of thing. But generally speaking, if someone has a life expectancy more than 10 years and they have, an aggressive tumor, they would be benefited by definitive treatment.
Getting rid of that thing.
Getting rid of it. So you can get rid of it, you can have radiation. There's a lot of good ways to get rid of it. And there's a whole continuum. I have some patients that say, I want it out of there. I don't want it there. And then there's other patients say, I don't want to have surgery no matter what. Like I want to have radiation, let's say. And then obviously most people are somewhere in the middle. And, you have to kind of individualize the risks and possible complications of each type of treatment and sort of see what fits best for each patient.
The thing I don't like about radiation is it can affect other organs around the prostate, and for all intents and purposes, surgery doesn't. I mean, they're not going to screw up your liver, nor a decent doctor anyway, like you, but they're not going to screw up your liver operating on your prostate, but they can radiate your prostate and something goes south with your liver or something else, or your colon or something else. I've talked to people that's happened to. You are one of the few doctors in Santa Barbara, there's only 3 of you guys, that do laparoscopic robotic surgery, which I had. I had mine done at the City of Hope. I went in on noon on Tuesday. I left their parking lot at noon on Thursday. I stopped off for lunch with my little bag and all, but talk about laparoscopic robotic surgery and its advantages, because there are several.
Well, when I was learning how to do prostate surgery, we made an incision from the belly button down to the pubic bone on everybody and took the prostate out. Most people were in the hospital about 5 or 6 days, and it was pretty big deal. In the last 6 or 7 years, we've gotten this surgical robot. And what that is that you, instead of making a big incision, you make 5 holes about this big. You put instruments in through these holes and you attach it to a robot, to a machine. And then the surgeon actually sits at a table, puts a glove on, like a glove, to move these instruments and watches on TV and does the surgery that way. So robotic surgery is still surgery, and whenever you have surgery, there's a chance of complications and there's risks of everything. The big advantages of the robotic surgery are that most people have less pain because they don't have a big incision. Most of our patients go home the day after surgery. When you look at the big series, and people who've done thousands of robotic surgeries and thousands of open surgeries, and you look at things like cancer control and control of urine and sexual function after surgery, the robotic surgery and the open surgery is similar. I don't think you can say that one is better than the other.
But getting out of a hospital 2 or 3 days sooner and not getting a staph infection and the cost of the thing and laying in bed for all those days, that's an advantage.
Right, and the one thing that has been shown to be statistically significant is less blood loss.
Well, not only that, but you don't have that big hole that has to be stitched up and has to heal. We don't have a lot of time left, but we've got about 10 minutes or less, but I'd like you to talk about every guy that has prostate cancer, the first thing comes to his mind is, I'm going to be incontinent, and if you're at an age that you're having sex, is my sex life is done. There's a lot of mental stuff involved with that, because I went through that. You're going to have problems with erections. There probably is going to be this or that, and the next thing you know, you plan for a negative effect, and a negative effect happens. I'd like you to talk about both the impotence thing, the sexual erection thing, and the incontinence.
Okay, so that's a very good question.
And I bought a box of diapers, I'm talking a case. Never used one, I shipped them back.
Oh, that's good.
Well, I was lucky, but that was drilled into me. Well, you're going to be,
So the two, like I mentioned, whenever you have surgery, there are risks. And besides the usual risks with any surgery, like bleeding or infection or, blood clots and that sort of thing, the biggest thing with radical prostatectomy is the risk of leakage of urine and the risk of sexual function problems. So when you have your prostate removed, as you know, while you're asleep, there's a tube or a catheter that's put through the penis into the bladder. That tube stays in for approximately a week. When the tube comes out, most people do have some leakage of urine. It usually gets better. For the most part, it takes 6 to 8 weeks, and it does slowly get better. After everything is healed up, like let's say you look a year later, about a quarter or a third of patients might leak a little bit, like when they cough or sneeze, leak a few drops. The risk of total incontinence, in other words, urine just pouring out, is probably about 5% of patients that have that after this kind of surgery. And it does correlate with age. People in their 40s or 50s have much less trouble with leakage. People over 70, and especially over 75 at the time of surgery, have more trouble with leakage of urine afterwards. Right.
What about the sexual thing? I mean, there's some things that you can do, but let's say the worst happens and the guy cannot have sex, can't get an erection. What can you do for him?
Okay. So, we used to tell people, if you have this operation, you're not going to have an erection. But over the last 20 or 25 years, actually, this is a guy named Pat Walsh who trained at UCLA and was chief at Hopkins. He said, well, why can some people have an erection after surgery and some people can't? And he went to the lab and looked at cadavers, and he found out that there's nerves that run right along the side of the prostate that control erection. And if you tease those nerves off the prostate and remove the prostate and leave those nerves there, then a man has a very good chance of having erections. If you take one nerve, it's still possible to have erections. If you take both nerves, then you're not going to have normal erections. So we look at the prostate biopsies, and if they're the ultrasound or the MRI, if they've had them, and try to figure out if we can save the nerves and tease those nerves away from the prostate and remove the prostate without damaging the nerves. The other part of that also has to do with age. People over 70, even if you save the nerves, don't have as good erections as people, let's say, under 50, under 60.
What can you do for those guys?
Okay, so what
are some
can
of the
you
things
do?
you do for those guys to allow them?
So certainly you can use pills for many people, like Viagra, Cialis, and Levitra. And in fact, people that we do nerve sparing on, we start them on those pills right away, like when the catheter comes out, the first week or two after surgery. It's been shown that if you start the medicine right away, you increase the blood flow, you get less shrinkage of the penis, and quicker return. So those pills are helpful for many people. Some people, the pills don't work. The next step is either a vacuum device or injections. Injections means giving yourself a shot in the side of the penis. There are drugs that you can use. You can give yourself a shot that will give you an erection. And then a vacuum device is a plastic device that's put over the penis, and you pump it and it pulls blood into the prostate. Pulls blood into the penis, and then you put a rubber band around the base of the penis to hold the blood in there. And that works for many people.
What about implants?
And then the next level is implants. So there's different kinds of implants, but basically a penile implant is a surgical procedure to put a device inside the penis that can make it rigid enough for intercourse. And
what do a lot of guys opt for something like that? I mean, relatively?
Yeah, again,
if all else fails, you're
yes,
not much choice.
Yes, we usually like to wait at least a year after surgery with either the pills or the injections, the vacuum device, because sometimes the erectile function will come back. But if it doesn't come back and they're not doing well with one of these other treatments, then I think a penile implant is a great treatment.
Well, what about...
One other thing I'll just say,
no, go ahead.
We talked about the other part on sexual function is we talked about the prostate making the semen. So when you have a climax after you've had your prostate removed, there's no fluid or semen that comes out. You can still have an orgasm, but nothing comes out. So you wouldn't be able to have a baby if you've, for example, if you've had your prostate removed.
I'd like to give your telephone, if doctor's telephone number is 681-7564, and he's at the Sansom Santa Barbara Medical Foundation Clinic. What overall, where do you think this prostate cancer thing is going to go in the foreseeable future?
I think in the future where there will be more focal therapy. That means figuring out exactly where the tumor is in the prostate and maybe just hitting that one area, either with radiation or with freezing, and saving the rest of the prostate.
Thank you so much, Dr. Alex Coper. We've run out of time. We'll see you on May the 15th with Cecilia Rodriguez, who is the Executive Director of CALM, and we'll do a show on child abuse and what you can do to spot it and prevent it. Again, thank you very much for being with us, and thank you for watching, and we will see you in a couple of weeks, 3 weeks to be exact. But anyway, make sure that you get your PSA tested. That's very important. Be careful out there.